So just for those who don't know, and I'm probably, you know, preaching to the converted, but Parkinson's disease, as we know, is a progressive, insidious neurodegenerative disease. There's about 70,000 people that we know in New South Wales, not including carers, family members, and significant others. And so we all know that it has these motor symptoms of tremor, rigidity and slowness, and postural instability. And then there's a whole bunch of non-motor symptoms. And so while Parkinson's may not impact upon or cause vision loss, there's certainly some evidence of impairment of the movement of the eye that can affect people with Parkinson's. So just curious, what are the issues you're experiencing? Have you been to an optometrist that told you everything was fine, nothing to worry about? Have you been assessed by an ophthalmologist who also said that your eye refraction was fine, nothing to worry about? And did they tell you there was nothing wrong with your eyesight? And did you also then tell them that you had Parkinson's disease? Is that something to consider when we're going through these slides and having a discussion? I was actually fortunate because many years ago I worked in an ophthalmology ward, and so I got to know kind of quite a few of these eye muscles. And there's actually 6 muscles that affect the movement of our eye. And so I think that's important to know. If you think about Parkinson's and lack of dopamine and how that affects muscles and coordination, then there's probably a role in the lack of dopamine and how that affects the movement of the eye. Behind the scenes, you know, we have a retina, which is the innermost layer of the eye. There's millions of nerves that we call rods and cones that respond to light. These attach to nerve fibers that eventually become the optic nerve, and that thereby links the eye to the brain. In the visual cortex, which is a primary part of the brain, this receives, integrates and processes visual information. And we talk about the lobe, the occipital lobe, as being the major lobe of the brain that processes information, but also the parietal and temporal lobes also help to analyse the things that we're seeing. And there is evidence that the ability to distinguish colour and shade can also be, impaired with the loss of dopamine. Everybody hanging in there?
Yes.
Oh, thanks. Oh, I got a coffee delivered to me. Isn't that lovely? So,
hey, Rach, sorry, we're still on the first slide. Are you moving slides?
Yes. Sorry.
You're right.
So hang on. I might have to go back to doing it this way then. Sorry. Yeah.
Yep. There we go.
Okay. So we'll go to here. Back to here. Is that right? So that wasn't moving through. Sorry, everybody. So these are the eye muscles that I was talking about. I won't go through them, but I always thought the superior rectus muscle was an interesting name for a muscle in your eyeball, not your bottom. So we have to rely on these muscles to move our eyes back and forward and up and down. And then again, I was talking about the retina and the nerves that eventually attach to the eye to the brain, and this is the brain that processes information. So we know that most of our visual processing is done in the occipital lobe, but definitely the parietal and temporal lobe help us to interpret that information. Okay. All righty. So you might have known, or you might be aware, that when you go to the neurologist or to your GP, that sometimes we test your eye movement. And so what we look at, you might remember, we get you to look directly at us and we ask you to either follow a pen or a finger. You've seen us do this, and up and down. And so what we're actually looking is to see if there's smooth eye movement. And typically in people with Parkinson's, it's usually quite smooth. Sometimes we might see what we call saccades or rapid eye movements. And so they sort of flicker across and flicker up and down, and that might indicate some impairment in eye movement. We also talk about saccades in people that may have progressive supranuclear palsy, which is a Parkinson's plus syndrome. So they have this sort of inability to look down. So the issues are around the cranial nerves that help with that eye movement, but which is also above the nucleus. So definitely difficulty looking down, and we can see that and these saccades. So we're looking for this smooth eye movement that goes with both eyes, and that they're both actually following in the same direction. And we can actually learn a lot from people doing that testing. So with vision and Parkinson's disease, we're saying that Parkinson's disease is not necessarily responsible for vision loss, but there's certainly a lot of other factors that can play into, visual disturbances or impaired vision. So we know one, don't we, straight away, people who have what we call a masked face or hypermimia have reduced eye blinking, and certainly in interviews when we're assessing patients, we look to see about eye blinking. I think one of the most beautiful stories I ever met was a young couple that had just recently met, and she said to me that when they were dating, she said she couldn't believe that this, her prospective husband just kept staring at her without blinking. And I said, oh, he was absolutely truly in love with you. But then she realised later that he actually had reduced eye blinking from his Parkinson's disease, which she initially thought she was a little bit creepy, but then she got to understand it. So reduced eye blinking can, often cause dry eyes, and that can be a problem too for people. Always want to make sure that your cornea is, nice and moist as well, so you can use some eye drops. So, sorry. Okay. So if we think about these muscles again, and if we think about how bradykinesia, the word, you're familiar with the slowness of movement. If that causes slowness of movement, then also that can impair the coordination, and that can be worsened with fatigue, so that this, that your eyes, as they're moving back and forward, may result in a non-alignment of movement. Okay. And then what would that cause to happen? You probably may have some things like double or blurred vision. So according to some statistics, 30% of people with patients with or people with Parkinson's do report double vision. You might have seen that written down as diplopia, di meaning twice, or lopia. And so it's possibly to do the double vision when your eye muscles have difficulty tracking. So for instance, if you're reading from side to side and the muscles are slow, that may cause some blurred vision, double vision and blurred vision also when tracking. It's pretty blurred vision down there, isn't it, in the picture you can see. Okay. There's also a lot of discussion about whether the loss of dopamine can also impact on people's visual spatial orientation. So that's about judging space or distance between objects. And so it sort of really makes it difficult moving around or negotiating smaller spaces has been quite difficult. So, as much as we don't want to ever have to acknowledge some of these issues, but it's always really good to check your driving ability if these things are happening. If you misjudging distances between objects. This is another common, this is actually another muscle. It's called, I can't pronounce it properly, but it's called the levator palpebrae superioris. And this actually controls the eyelid ability to open and close. Okay, and I know I've had quite a number of patients that suffer from a condition called Blepharospasm. So bleph means to be the eye, and the muscles can spasm. And so people can be burdened with this sort of repeated twitching, or they have difficulty opening their eye, and it's hard to close their eye. So there might be a few people out there that have experienced that. It's a great fun disease, this Parkinson's, isn't it? I think it's also really important to include illusions and hallucinations when we're talking about vision and Parkinson's disease. I'm always one to look at what we call prodromal, or what happens before the diagnosis of Parkinson's, or the early aha moments, because there's much malignment, I think, about the use of anti-Parkinson's diseases and how they contribute to illusions and hallucinations. But there's quite a lot of studies that say, there's a fellow called Weintraub who I actually got to see present at the Kyoto World Conference on Parkinson's disease. And he says there's quite a lot of evidence that illusions and hallucinations can occur fairly early in the disease. Which I think is quite interesting. And you also may be aware that when you have a consultation with your neurologist or your geriatrician or whoever, we often ask you about this feeling. It's called the passage and presence phenomena. And so we say to you, do you feel that there's a sense of presence in the room? Do you feel that someone's there? And then when you look over your shoulder, you realise that there's actually no one there. So that's an important, I think, a thing to, as a part of a a Parkinson's non-motor. And so there's another really interesting study that I've been looking into. I forget who the author is. I think I've got it at the end. Oh, it's still Weintraub, and he actually has been trying to determine whether people's visual hallucinations in Parkinson's, how will they differ from someone with a psychiatric symptom, which I always think is really interesting because it may point to a different underlying pathophysiology of what causes visual hallucinations in people with Parkinson's as opposed to a sort of a affective psychiatric disorder. Always totally interested in that stuff. He also acknowledges in his research that that there is an increase of incidence in illusions and hallucinations as the disease progresses. And we also acknowledge that, so there's been a lot of research about visual function and what obtaining a baseline as to see how it may contribute as a risk factor for people to develop hallucinations later on. Am I going too fast, Sarah or Cassie? They're okay? Okay. There's another very interesting article that I carried around with me when I was working in Port Macquarie, because people often ask me about visual hallucinations, and this was actually an article that was done in 2014 by a bunch of authors, including Muller and Simon Lewis. And again, they noted that people had an occurrence of visual hallucinations in people with Parkinson's with or without dementia. So I think we often tend to think that it's a very progressive phenomena that occurs, with advancing disease, but he definitely acknowledges that it occurred in a very de novo state, people haven't actually started on much medication or had an advanced disease. And they talked about how these hallucinations can range from sort of non-menacing images. There's one beautiful man in Port Macquarie that used to see his beautiful wife who had deceased giving him a cup of tea first thing in the morning, and then he realised she wasn't actually there. Personally, I'd be very upset about that. I'd be more upset about not getting my cup of tea in bed, but anyway. And also there's a lot of research too about they call the images like the Lilliputian. So it's, often children or small animals that people see, and scenery. And we also are very cognizant that that visual hallucinations certainly contribute to caregiver stress, because it's a sort of very challenging thing to negotiate. And we know that it can often occur with or without provocation. I mean, like medications. When people are sitting in a dimly lit environment, they can occur. And often an intrusive dream can still keep going when they awaken. And I think people with lack of stimulation, probably from early afternoon to nighttime, can often have, increased risk of these hallucinations. We probably need to talk about glaucoma too. So glaucoma is, occurs in a lot of people anyway. So it's when we get this raised intraocular pressure in the eye. And so in the front of the eye, we have this vitreous humor. It's sort of a jelly substance-like substance, and that flows through into the back of the eye, which forms the eyeball, the vitreous humor. And I always remember there was this wonderful lecturer when I was doing my nursing, and he talked about how he made a lot of money. One day, this woman had actually just won the lottery, and her pupils dilated and got fixed, and that closed off this angle in her glaucoma and caused her an acute glaucoma. And he said that she ended up having to use her winnings on actually having to get her acute glaucoma fixed in surgery. And then people with chronic glaucoma too. So it's really important to check your consumer medications information for Parkinson's disease. There's often a lot of contraindications for acute angle or narrow angle glaucoma, drugs such as Artane and Nupro. Interesting enough, when I've highlighted that to neurologists and said, you've just increased this certain medication, and we know that this person's also using eye drops for their glaucoma, do we need to check that? And they've often felt that it was safe to proceed with the medication. So anyway, it's still good to check in with your doctor or pharmacist about those things. It's always I read a lot about, you know, vision and Parkinson's, and it's always really interesting then to go back into the databases and see what's happening in terms of research. I had a quick look last night through Medline, and there's loads of articles when you do a combined search on Parkinson's and visual disturbances and so on, but there was two that I felt that were quite interesting that I wanted to share. It was a very small scale, and it was also a retrospective study that was done actually in a centre in India, a neuro-optometry centre, and they had they had 43 patients. There were 7 females, 36 males. They were aged average between 50 and 86 years, and they approximately had Parkinson's between 4.5 years. And so they looked at the visual features of these patients, and what they found was that there definitely was decreased vision associated with reading it. They thought 40% of these people felt that this was a common thing, and they talked about they actually recorded that their vertical gaze, so going up and down, had a greater involvement, or a vertical gaze palsy was like 35% as opposed to horizontal involvement, which I thought was quite interesting. Because when we talk about reading, and if there's difficulty tracking across the page, that would imply a horizontal involvement. And so, yeah, vertical gaze meaning moving eyes up and down. They didn't actually talk about the mechanism, but they talked about the occurrence. And the other thing they said that they talked about this thing called convergence insufficiency. And they said it was the most common binocular vision dysfunction. And what it means is that people with Parkinson's, and if you look at the bottom diagram, can you see that okay? So you've got your 2 eyes and you're trying to focus on a word in a book, but there's a convergence problem. So people, their eyes are not fixing on the same spot, and that can cause, double vision blurriness, okay? And so and then there was also convergence insufficiency with an ocular eye motor dysfunction. So there's certainly evidence that people with Parkinson's, have these findings. Mind you, small scale, retrospective. There was another 2013 research article that was, looking at visual disturbances in Parkinson's disease. And much like descriptions of pain, they said it was underreported, under-recognised and poorly understood. And I guess that resonates with me when people have actually come back from their ophthalmologist or their optometrist, and they said there's actually nothing wrong with your eyes. We don't know what's causing your blurred vision. It was called Vision in Parkinson's Disease, the Patient's Perspective. And it was a 44-item vision test, which I actually hadn't heard of before, called the Parkinson's Alliance Vision Symptom Scale. And during this, they realised that there was reading difficulty, there was glare sensitivity, visual fatigue, nighttime vision difficulties and blurred visions. So pretty interesting. And they also noted that the disease duration was actually more important than somebody's age. So, if somebody was much older and they had a disease duration for a short period of time, they may have been better off than someone who was, possibly younger with a long disease duration. Their findings and strategies said that we need to look more at that self-reported perspectives of people with Parkinson's, and that in order we can understand a better understanding of their visual disturbances, and that can guide assessment strategies and treatment. I think we've probably covered most things. Just tips for eye and vision care. We're always suggesting ways to, self-care. So having your eye test with optometrists, reviewing your vision with your GP, and always with Parkinson's, we're always looking to exclude other causes for double vision or blurred vision, such as diabetes, making sure that you get a good night's sleep, using artificial tears to manage dry eyes, making sure that you've got good lighting to reduce your falls. We know that Botox injections can play a good role in Blepharospasm, or that eyelid apraxia. And I really like Kathy put this in her talk about the correct position of glasses. If your posture is starting to stoop, that you don't, that your glasses are not falling off your nose. If your posture's stooped a bit forward, great tip. I'd also like to direct you to the Parkinsons New South Wales website. They have an excellent article on vision and Parkinson's, which I totally recommend that you have a look at. And it's also, I've recommended to many people when I've cared for them to take that along with them when they are going to the optometrist as some sort of credence or validity that yes, there are some issues around eyesight and vision with Parkinson's, and that you know, not to be so, well, there's, you know, Parkinson's doesn't affect vision, so you know, we can't include that in our assessment, but I think it's really important that you do, you know, that you would take that along. And also just to stay in touch with us, you know, on the Parkinson's website.